good morning, everyone, and thank you for joining the Patientory Association's quarterly webinar series. Today's webinar, we will be focusing on impact in healthcare with blockchain with our special guests, Blockchain Consortium International and Patientory Association ambassadors. I'm Krista McFarland, the president of the board of the association. The Patientory Association was incorporated as a global nonprofit healthcare member organization in order to meet the needs and facilitation of adoption of emerging technologies in the healthcare industry. We provide educational content and events, most commonly known our Block Health Summit, which launched in 2018 and now partners with the Dubai Smart City government in an annual conference on promoting the advancement of blockchain in healthcare. Currently, the association connects healthcare industry adopters of the PTOI network blockchain. The PTOI network blockchain securely stores and manages health information in real time, and such storage and management is facilitated by the blockchain-based token called PTOI, the world's first healthcare cryptocurrency. The goal of today's webinar will be to give a deep dive into the different use cases of blockchain in the healthcare industry. Our presenter and moderator, Talisha Shine, is an experienced digital health professional with a demonstrated history of working in the information technology services. As a certified blockchain expert and a GBA certified blockchain consultant, she combines her nearly 20 years of IT software support experience with a Bachelor's of Science in Computer Information Systems and a Master's of Business Administration to provide a full spectrum of client system development. Talisha founded the original ScopeScribe and now serves as the Vice President of Blockchain Consortium International, a blockchain consulting company. Talisha, welcome. We're so excited to have you to present and moderate our first panel of the year.
Yes,
thank you. Yeah, can you talk more about yourself, and then you can introduce the ambassadors who will be supporting you during this presentation.
Certainly, and I'd like to again welcome everyone to today's session. As Chris has said, I'm Talisha Shine. I'm the VP of Blockchain Consortium International, and we're going to be discussing today how to build a better chain. I'm going to give you a brief background on myself, highlight the building blocks of blockchain and where blockchain is today. And we're going to take a look at the patient data from insights from our current ambassadors who are on with us today, as well as some of the obstacles and barriers that are faced on its way to adoption. So I'd like to start here by showing you here where we're going to go, and also introduce our ambassadors for this afternoon. I believe we can start with Adelthafa. Everybody can hear me?
Yes, I can hear you.
Great.
Good morning.
Good morning.
Talisha. My name is Abdul Fattah, the co-founder of emergeblockchain.org and also blockchain strategist, where we basically advise on the government level as well as and mostly focusing on educational, because we know it's blockchain technology is in the educational phase, and still to find out and still to learn. Everybody should know that.
Thank you so much for joining us today. Ms. Eva, would you like to go?
Thank you, Talisha. Good afternoon, everybody. My name is Eva Mowbray. I'm the Director of Marketing at Iris Guide UK Limited. For those who are not familiar with what we do, let me just do a really brief introduction. Our iPay technology is a secure financial delivery platform utilizing end-to-end iris recognition technology, such as iBank, iCloud, iCash, to securely deliver and cost-effectively deliver financial services to the world's unbanked patients and vulnerable populations. Iris recognition is the most advanced and secure authentication technology. And I suppose the uniqueness is that it's not a one-to-one identification. We find one person in millions, anywhere in the world, with 100% accuracy in less than 3 seconds. So it all happens in real time. And I suppose the second most important part is we don't need any other ID. We're just using the person's iris. Thank you very much.
Thank you. And we'll go to Kareem at this point.
Hi everyone, I'm Kareem Malhas and I'm the blockchain officer at Iris Guard.
Thank you very much. Anhal?
Hello, everybody. I am Angel Rabines. I become of clinical and healthcare management. My background is a medical doctor, and actually I work in the two areas, nuclear medicine and healthcare management. And I joined the Pacientary Association the last year because I think the blockchain is the best alternative to building the safer and best healthcare system. Thank you.
Thank you. Chris, are there any other panelists that we have at this point?
I believe we have Dr. Mazen that has just joined us.
Great. Dr. Mazen, can you take a second and introduce yourself?
Yes, can you hear me?
Yes, sir, we can.
Excellent, excellent. So my name is Mazen Gadia. I'm an ambassador with Pacientary Advisor Association, and I'm also a director at IQVIA. I've been in healthcare, digital and innovation space for the last 20 plus years. Again, very enthusiast and very much involved in the healthcare strategy and digital transformation with the innovation of blockchain.
Thank you very much. So we're going to start the presentation at this point, just giving you a little background with regard to Blockchain Consortium International. We provide high quality documentation for internal and external use.
Felicia, I think
yes?
we have one more ambassador that.
Oh, I'm so sorry.
Shivam Tripathi, and then we can move forward.
I'm so sorry, Shivam. Go right ahead.
Yes, hello. My name is Shivam Tripathi. I'm an analyst in the finance department at Northside Hospital, and my goal is to improve clinical operations and the patient experience, and blockchain is a vital component of doing that. Thank you.
Thank you. So again, back to Blockchain Consortium International. You'll see here, like I said, we provide the high quality documentation for both internal and external use to improve the user experience, streamline your business summaries, deliver client and partner onboarding, as well as to optimize utilization of all the technologies. Our mantra is we're linking adoption to step-by-step documentation. So as we look towards adoption, there's a few numbers that kind of stick out that make us kind of consider where we're going and the safe hold that blockchain has. So a recent survey by Global Market Insights, excuse me, revealed that the blockchain value of technology and healthcare market is expected to surpass $1.6 billion by 2025. And this growth will be due to blockchain implementation and initiatives, both by our private sector as well as government agencies. And we're going to talk a little bit more about a government agency initiative later on in the presentation. And according to the BIS research, 55% of healthcare applications will be adopting blockchain for commercial deployment also by that year, 2025. So we'll see an expansive amount of growth in the next 5 years. And that's with reviewing the medical outcomes, interoperability pursuits, as well as cost reduction efforts. These are going to all be components that help us move that blockchain adoption along. So now I'm going to discuss the 5 elements of blockchain. There's a really great book called The Real Business of Blockchain, and it provides this wonderful illustration of the key components to the optimization of the technology. And so you'll see here, those 5 components are distribution, encryption, immutability, tokenization, and decentralization. And it truly is the combination of all 5 of these that truly will see the technology be in its most optimal form. So with the distribution, we'll see that everyone will be located from, across the globe, but we need one connected network. And so everyone who participates on that full node will get complete access to any of that information of the ledger that's updated and those new transactions that occur. We also have the ability to look at encryption, which is, again, the use of public and private keys, which is crucial specifically in the healthcare industry, with making sure that we follow all the policy and procedures, as well as the security of the data. Immutability also is something that's very vital in the healthcare spectrum, making sure the records are correctly identified and signed and worked with within that confine. And then in the tokenization, which we'll talk about also later, is with regard to having the ownership of the data. Who is actually responsible for it, the consent of the data, and how will it be distributed? And the last critical piece here, which will be the decentralization, truly taking that form of having all of these together in a decentralized mode, allowing everyone to participate at will and giving the correct information at needed. And now I like to look at kind of the timeline and how these elements align to bring in full force the blockchain optimization. As you see, we'll have the series of Internet ofs, and this is the Gartner blockchain spectrum, which kind of gives us a really great look at how these elements actually work together. So the first we'll see here is prior to, in the early 2000s, we have the Internet of Information. At this point, we have two of the elements kind of working in tandem with one another, which are the distribution and the encryption. We see that with HTTPS sites, having that security, being able to use a privatized internet access to get to information. That's where we have the enabling of the technology. That's the true foundation of where this technology will be bred from. Now moving on to the mid-20s, as we're right here, the Internet of Consent. This is where we'll see the input of a new aspect, and one of those elements crucial to that, which is tokenization as well. That's, again, giving that ownership over to individuals, allowing that information to flow in a different manner than just giving total consent. When you snap the actualization and saying, yes, I consent, you now have an ability to discern who and what gets that information. And now moving again to that 2025 date and beyond here, we'll see the Internet of Value come to play. This is where a complete blockchain system will be realized, but not exactly optimized. We'll have all 5 elements working together, giving us that robust aspect of the blockchain. But again, it's probably past the 2030, as they put it here, that we'll see the optimization come full force. So we're going to move on now to the major impact of blockchain in the healthcare industry, which is going to impact patient data. And these are the core cornerstones that I think really hit home, and this is where we're going to engage our ambassadors to kind of talk about these particular areas and how they actually will see the utilization of blockchain. So I'd like to begin with Ms. Eva with regard to digital identity. That's the first thing, as we identify the patients and how we come to understand who and what we're talking about. Can you give us a little bit about how the improvement of the digital identity and efficiency happens when we introduce blockchain?
Yeah, absolutely. Thank you very much for that. So yes, when it comes to healthcare, it's absolutely critical to correctly identify a patient, to ensure their safety, to make sure they get the right treatment. And there are other aspects, things like, eliminating insurance fraud. And we need the ability, especially when it comes to private healthcare, to link an identity, a person with billing, in order to have an accurate audit trail for all the medical treatments. There is, of course, an element of value when it comes to dispensing high-risk medication, clinical trial management. So whether the challenge is striving to deliver quality care, cut fraud, grow and improve clinical research trials, all of those different areas, it all starts and comes down to digital identity. And it ends with a secure health ecosystem and, of course, secure electronic medical records. We all know what's going on in the situation at the moment, so there are other biometrics in place, but I just want to point out the huge importance, especially now, about the biometric methods being contactless and therefore 100% hygienic. Patients who are more informed about their medical conditions, they have good access to information, they more engaged to their treatment, so they'll have better health outcomes. The technology that we provide covers a number of key benefits. So from the point of view of healthcare professionals, you know, they can identify patients correctly, control access to medical and professional data, including blockchain, audit trail efficiency. For individuals, they are empowered because they own the data. They, have the power to access their data and to protect their data. We don't use any other IDs. We connect with the cloud, with blockchain, and therefore, you know, as individuals, we know that our identity and our medical records are protected and safe, you know, only accessed by ourselves or the authorized medical personnel. We also expect that whether we go to the GP, whether we go to hospital, whether we end up in a pharmacy collecting medicine, whether we're in an emergency situation on the way to hospital in an ambulance, that everybody has access to those medical records, the history, any allergies, anything that may affect the treatment. So, you know, that's what our technology offers. I'll ask Karim to see whether he would like to add anything from the blockchain side. Karim?
So from the blockchain side and digital identity, I think the most important thing is we give every user the ownership of their data. That's the key thing about the blockchain. So everybody has the power over their data, regardless of whether we use iris recognition or not for that. I think in terms of people owning their data and having the right to, they have the right to their data, and they can allow or not disallow people to see that data because they own it. This is the power. And this is where the blockchain comes in, and digital identity is so important because nowadays nobody really knows where your data is and who's using it. So with the blockchain, this solves a real issue. And that's my comment on this.
Thank you very much. That leads right to the ownership aspect and the tokenization arena that we're looking at here. So Adelpha, I know you have some aspects with regard to how blockchain actually creates that value and ownership for patients also in the academic area as well. So if you can highlight that for us.
Sorry. Yes, certainly. Can you hear me now?
Yes, we can. Thank you.
Excellent. The main purpose of tokenization in blockchain technology or the healthcare industry within the technology is to facilitate trustworthy transactions between the participants within the ecosystem who may otherwise not to trust each other, you know, if there is no records of it, and if there is no audibility, auditing, in place, and thus tokens like PTOI of Patient Association, the first healthcare token, is said to perform 3 critical functions, mainly that it is a store of value, all right, and a unit of account, and means of value transfer. Otherwise, in other words, that the patient, when they hold, or any institution hold that token and have their data on the platform, on the protocol, or use case, mainly the use case that will interact with the patients and with academia, where the information is completely secured and completely transparent, and also there is no misinformation. And we know in healthcare is that one doctor forgot to put the information, and then the next doctor will diagnose the patient incorrectly, but if there is a value transfer like a token or tokenization, where the value is transferred easily between the participants, then there will be efficiency. Also, within the academia sphere, is that research and new inventions within a certain illness or certain medication is easily obtained. You know, the information is easily obtained from the different hospitals, as well as from the university to the industry, and from the industry to it is a two-way value transfer between those different industries. And the tokenization, basically, it's something that will facilitate and also take account and create value for content.
Thank you so much. Shivam, I'd like to go to you now with regard to, I know you have some thoughts about the ownership of data and what the benefits of blockchain are. So if you can talk about that briefly, that'd be great.
Yeah, definitely. As far as the ownership of data, as you guys mentioned, it is blockchain is a ledger of transactions that are distributed, and just having that immutability and understanding who has access to that record, it gives the patient, I guess, confidence and security that they are knowing who's accessing their data at every single transaction. It improves the trust by ensuring the information is accurate. And since blockchain is decentralized, the information is stored across a hub of computers and service systems. And so this makes the medical records can be difficult to access, but they're generally spread across many different healthcare facilities. So blockchain, in essence, enables the patients to have full and secure access of their records and medical history.
And do you think tokenization has an incentivization portion as well to patients using that and understanding where their data is going and allowing people to use their data?
I definitely do think tokenization is a vital component, just because having that gives them gives the patient consent on who can access their data at a certain time, and it's not necessary for other individuals or employers to be looking at their data if it's not needed.
Thank you so much. Moving on from that to consent, we talk about that as well. And Dr. Mazen, I know you have some aspects with regard to how the blockchain helps with the consent and how that consent is handled. So we have the data rights and access. Can you talk a little bit more about that?
Yes, absolutely. So the potential of actually implementing or employing the blockchain technology in the consent process, specifically as you're building health information exchanges, is huge. Can you hear me? Just double check it.
Yeah.
Okay, so even the art of tokenization itself, where the patient would actually through the patient portal that is built out of a blockchain instance, would allow or would indicate data to be accessible from a provider is a huge potential. It's one of the biggest headaches at the moment with conventional technologies as we're building health information exchange in the region, for example, in the Middle East. And the concept of unified medical record, the build of the transactions between patient portal to for example, the EHR viewer, as well as the local EMR instance, could be tokenized in a blockchain fashion, where the audit trail is built and the consent is given and stored in an instant. So again, there is no full or a technology that actually could mirror or automate the full consent management from patient to provider, back again to the patient. So again, it's a very interesting use case that has been highlighted as a huge potential, with obviously the immutable capabilities and characteristics of blockchain-enabled solutions, as well as the transactional nature of consent management and how data could be accessed based on a patient owned task or capability to allow providers to see.
Thank you, Dr. Mazem. So each of these components, as we've talked about, the digital identity, the tokenization, and consent, all rely on the security of the data. So that's one of the biggest pillars here. And I'd like Angel to talk about the magnitude of the security problems that are faced with current patient data, as well as when we introduce it into the blockchain. Angel, I don't know if you can hear me or if you're on mute.
Can you hear me?
Yes, there you go.
Thank you, Talisha. I would like to present the context of the problem in the health organization. Actually, an increased number of health organizations manage health record through digital solutions to improve the efficiency, quality, and transparency of the healthcare system. The health data security must remain a top priority for organizations of all sizes. More electronic data is available than ever before, and covered entities are looking to find the most efficient and secure way to manage it. Patient data is extremely valuable to hackers looking for detailed identity information, which make securing electronic health records and associated personal details a top priority in the health industry. Data breach can cost health organization $400 for affected records. In the last year, the report said that 180 million patient records have been exposed in data breach. It's really a problem. IBM report that only in USA, the cost of the breach and data patient was $8 billion. So one of the main reasons for healthcare stakeholder organization, patient, governments turn to blockchain technology is the security. The feature, even if a blockchain is transparent, blockchain no compromise the privacy of data to avoid show the identity of the individual by of complex and secure codes which prevent the sensitive of medical data. I think that blockchain technology may offer a solution to healthcare budget security challenges, features of decentralized storage, cryptography, transparency, immutability, traceability, trust, smart contracts, elimination of intermediaries, parties, patient consensus, provide a framework for organization to improve the data protection while maintaining accuracy and preventing unauthorized access or alteration of patient information.
Thank you so very much for that. This is a large issue, an undertaking with regard to security. And all of these, like I said, each of these have a strong play in how the adoption of blockchain happens.
And also Bobby Harried is also available to Leisha.
Okay. I'm going to get to Bobby with the EU because he's going to talk all about that. So we're going to delay him for just one moment. But as we go into the adoption aspect, we're always going to hit some barriers and some challenges. And I know some of these just happen with regard to any new technology. When we had the EHRs being introduced, there was a lot of pushback with regard to that here in the US. And again, just the the aspect of changing something of the way it used to be into something new. So Dr. Mazen, I know you have some interesting information with regard to the health exchanges, as well as how clinicians will be receptive to this change, and what do you think we can do to help that along?
Absolutely. So the health information exchange is again another potential use case, or perhaps a potential implementation model to be actually modeled against blockchain technology. So the idea of transactions and having EMRs talking to each other, or transacting data between two different EMRs. So the routine way is actually during we use HIE engines and adapters, like the normal technologies that have been outside in the market already. The idea of actually implementing a blockchain, it still hasn't yet fully obviously scaled up, but there are instances of building an exchange between healthcare systems that are being piloted, for example, in the Emirates of Dubai, where two licensing systems are actually connected through a blockchain transactional platform that allows physician licenses to be checked and double checked and perhaps validated, and to remove duplication and obviously validate some of the data specifically for when doctors are applying for the licensing. So it's still in pilot stage, but that's an instance where two healthcare systems, be it in the licensing domain, that are transacting using a blockchain auditable trail that allows actually multiple instances of validation. So healthcare professionals can actually validate some of the uploaded documents, some of the actual stages that the licensing process takes the doctors through, and then obviously by allowing people to sign off on that and storing the audit trail throughout the instance. And this is being tested at the moment. On a bigger scale, again, yet to be scaled up, transacting between few EMR installs in the Emirate of Abu Dhabi still yet hasn't gone into a blockchain environment, but they are looking at obviously using that transactional capability and the ability to have multiple users access multiple transactions of a same EMR record at the same time by recording also those audits and on those entries as we go through. Again, the concept of security and privacy in the HIE is a huge issue, and the blockchain technology-enabled transactional platforms actually could allow some more flexibility and agile way of transacting, helping transactions between those systems.
Thank you again, Dr. Mazen. So as we proceed, again, this is where we're going to see some of the initiatives come into place. And Bobby, I know you have a great amount of information with regard to the EU Commission and the medical electronic records. So I'd love for you to give that information now.
Yeah, hi there. Yeah, I'm Bobby Harrod from Pfizer Chain, and I do consultancy in AI and blockchain. Basically, in regards to this question of EU of implementing new ID cards into obviously in the European Union, and obviously they're looking for a solution with blockchain. So I've got a few paragraphs that I would like to read out to you, which probably make life easier. Many aspects of blockchain technology, such as immutability of the data stored in blockchain, are drawing the attention of healthcare sector. Rosy prospects for many available cases are being discussed. Blockchain technology is expected to improve medical record management and insurance claim process, accelerated client and biomedical research. I'm not going to go into the other stuff. Medical data should be possessed and operated and allowed to be utilized by data subjects and other than hospitals. So basically all the European Union are trying to get information from the blockchain in terms of security. Blockchain technology is constantly improving rather than completing and getting complicated, with several potential challenges to be addressed and be adopted by biomedical and healthcare applications. The first challenge involves transparency and confidentiality, which obviously goes along with the security of the EU and the medical card and record. What we believe as the medical data itself is stored off the blockchain, but however, there's a problem with people accessing that data. Considering the number of transactions in the healthcare sector is enormous, the blockchain technology is revolutionizing and is quite needed in this area. Many believe that blockchain technology can change medicine and beyond, and I believe that Patientory can do this in many levels and many ways to be implemented now and in the future. And I think that's my point, basically.
Thank you. I also highlighted two interesting use cases and things that I think are really important with regard to not thinking of blockchain just as a singular technology, but as an integrated one. And one of the largest aspects is the use of AI with blockchain to leverage some of the aspects that, again, are appropriate for each of those technologies, and when combined, give you much more optimization. So there's a leveraging of them to reduce healthcare burnout, which is allowing physicians and clinicians as well to kind of do some of those routine things over and over and let the device do that for them. That has a great reduction of the medical cost as well. And there was an interesting, with regard to, I just found this article and I wanted to bring it to this panel today, where there was a drug designed by artificial intelligence specifically for OCD disorder. And that was based in England as well. So we're seeing AI being utilized in a whole lot of different ways and then being exported with the blockchain. Also, this will be a strong addressment of the opioid crisis here in the United States. Blockchain will definitely curtail some of the information exchange of that with regard to the dissemination of who gets those drugs and why, the shopping of the drugs around, getting those information, and also the aspect of if the drug is viable. That's something else that needs to really be here, because there is pain management involved. So we're trying to do the right thing by the patient, but also making sure that the addiction is not the likely outcome. So these are some of the things that I think we'll definitely be seeing a lot more of throughout the progression and adoption of blockchain. So at this time, I'm going to open it up for questions with regard to our audience. And I don't believe I will be able to see those. So Ms. Krista, if you can tell me what those are.
Yes, you should have them in your chat section for the chat box, but I'm going to read out our first question from John Cachego. I believe we can open it to anyone of the panelists. So John asks, what progress has been made on the blockchain challenges associated with 1, scaling based on transaction volumes versus computing power availability, and 2, standardization and scope of data, 3, incentives for participation and adoption, and 4, expense related to BKN technology, and 5, which is technology constraints.
Any of the panelists want to attach one of those? Great questions. I'll actually address the scalability. I know with regard to transaction volumes and computing process, this is something that we're working with regard to not only quantum computing, but again, within the actual purview of the systems. So some of these systems, again, are not fully decentralized. They are small permissioned-based systems. So with that, the transaction volume is definitely curtailed because they have the ability to do them in different stages as well as in bulk. So that's the scalability is within their own systems. They're seeing that they can gradually maneuver that and through that process.
I would like to tackle the question number 3 in terms of incentivize or incentivization for participants and adoption. I mean, as we spoke, with regards to incentives, both for the participants, also for the users. Therefore, information shared within the platform will also have a token attached to it, or a hashtag that will be shared, and depends on the token and the value of the token. The participants or the whoever is part of the ecosystem will benefit from that transactions and the movement of content. Mostly content that we're talking about, and it's not a content that's not verified. It's a verifiable auditable content that will make a significant impact in either academia or in the pharma, or pharmacies, also the drug companies, and for the patient. And in terms of the adoption, it's early time, as the technology is still evolving. It's still taking shape with regards to cryptocurrencies that are coming out, ICOs, all that hype. I would say there is definitely a hype, and there is definitely a real stress within different industries that they think blockchain will destroy the way they do business. It's all about how to strategize the entry to the technology, and it's important to have an ecosystem like we have, thanks to Krista and Talisha. And this is very important, where we meet and discuss the way forward, and only groups like that will take on the protocols like patientry association forward as a real protocol for real use cases to
come. I can say that I know one initiative that the patient shared the genetic information, their genetic information in the database, and this person is possible to obtain to benefit in the future because this data is shared with university, pharma, and another health organization. Incentive, I think that patient want to build a safe attention. I think that incentive is only for benefit the person. Another initiative in the farm industry is to fight to drug counterfeiting. I can say about this experience.
I see another question here with regard to how will blockchain and healthcare address the GDPR? And I think that also goes into the regulatory question that was posed before. I think, again, the standards will be initiated initially in a singular system. So again, those will be independent aspects, but as they grow and more interoperability has to surface, this is where we'll see the regulatory bodies have to integrate with themselves. So again, pretty much the building of each blockchain system will obviously take into consideration those current regulatory processes that we have in place. But I think, again, once we hit a level of interoperability where we have to speak to different systems, then there's going to be an overlay, and sometimes there's going to be more or less depending on where the data is initiated from. but we'll have to see some standardization across the board in order to, you know, realize and optimize the interoperability of the data.
We also have one question from Simon Reed. His question is, if 55% of healthcare apps do use blockchain by 2025, which of the major key areas in healthcare do the panelists see the largest usage in? Example, patient data, professional verification of qualifications, fraud, mis-ID during treatment, etc.
Hi there, Eva here, Iris Guard. I think probably makes sense for me to take this one. And I think I'll just probably bring it back to something that, that I've talked about at the beginning, and in order to address Simon's question, well, it would be all of those areas. You know, it all starts with making sure that we identify patient correctly, and I suppose also to just link with the previous question, GDPR, and I'll come back on the scalability as well. You know, with I suppose our technology, you know, and the way that we integrate with existing databases, including blockchain, I'll go into in a minute. The data actually can remain anonymous, you know, so when we integrate with whether it's a healthcare database or a different sector, we don't actually access any of the patient data. And we don't return any of the patient data. It simply links to the cloud, the blockchain database, and it returns an answer whether there is a match or there isn't a match, just simple verification. And it comes back with a number. So, you know, I think that could be key in certain regions where there's huge sensitivity to that. In terms of scalability, I won't necessarily talk about names or numbers, but we have integrated with a private blockchain, Ethereum, as a cryptocurrency and it was there to provide the transparency in blockchain transactions. And with this particular client of ours, we essentially helped to secure the last mile of the transactions through the use of Iris as a, you know, fail-proof authentication of identity instead of using the crypto key, and we're able to work with, you know, when to ask about scalability, we can work with 50 records, we can work with millions of records. So I think, you know, important to remember that the flexibility is there to handle some fairly large numbers. And I think, you know, also to go back to the ownership and power of holding the data. Again, you know, definitely see the value in both identifying healthcare professionals to make sure that the right people are accessing the data. But, you know, I want to hold my own key to my medical records because I want to make sure that I've got good experience and my identity and everything is safe. So I hope that helps somewhat.
If I can also add, I think one of the things about blockchain, blockchain can scale. Eventually, it will scale on a blockchain level. But I think what Simon's maybe alluding to is that we have issues of, even if you are able to scale it, how do you give the majority of the population of the world access to the blockchain and give them responsibility of having to deal with the private key, which can be lost or stolen, or maybe someone might manipulate you to get it, to take it from you. And from IrisGuard's standpoint, we guarantee, and this is why we've succeeded with other blockchain projects, that the person's biometric is his key, essentially. And this means that you can easily scale up in terms of there is no knowledge that anybody needs to understand about the blockchain. You just scan your eye or take the biometric, in our case is the iris, scan your iris, and then you can do any transaction you want. It's as simple as that. So there is no fraud. This is one important thing, because like if somebody takes my key and goes into my medical record as me and then takes my medicine, then this is fraud and it causes a lot of issues. So this is something that we should think about, merging the blockchain with the biometrics in some secure way to not compromise the person's biometrics data, yet also secure all of his true identity.
Yeah, can I add to another point quickly? I mean, although several possibilities have been discussed, the most notable innovation that can be achieved with blockchain technology is recovery of data subjects' rights. The medical data operated and utilized by subjects then other than hospitals and sent, obviously going back to Talicia's interoperability that differs from conventional methods, is that the most challenges that are arising from patient-centered interoperability is data standard, security, privacy, and in addition to the technology-related issues such as scalability and speed and incentives and governance, the issue can arise from all these areas. And I'm going back to the point that Simon made about specific research and access to the data and which areas it would accelerate. I believe that blockchain technology is expected to improve the actual management of medical records, which obviously is going to be the most common use in healthcare, because obviously without data, without patients, there is no data, there is no medicine created for that patient. And also the insurance claims process will be hugely accelerated, and biomedical research and advanced biomedical healthcare data ledger. These are the areas that the decentralized process would help to create an immutable audit trail and data provenance robustness and improve that security and privacy and other possibilities. But I think I would leave it on there. There's so much to say, but very short time to say it, shall we say.
I know. I would just add with regard to some of the use cases that are, I would say, the simplistic would definitely be credentialing and supply chain. Those will probably see the majority of the adoption happening with those because of the dApps that are created with them. And again, the ease by which they can be implemented. Credentialing is probably a very simplistic attack to it in the sense that it is just the verification aspect, but it becomes a very strong bottleneck with regard to some of our healthcare issues when we have healthcare crises like we have going around right now with regard to getting nurses and doctors who are abroad or somewhere else trying to be verified and being able to be credentialed to do what they need to do. That's a very strong use case. And like I said, very simplistic. Supply chain also will be coming right on the heels of that, because again, the need will supersede what needs to happen at that point. So I see another question here from Eric, my colleague here. And he says, do you see the potential in an alternative trading marketplace where patients are able to sell their tokenized medical data to multiple researchers? And I definitely think this is where we talk about academica and those hospitals that want to do the clinical trials and whatnot with regard to that, and how to incentivize the patients to be able to not only participate, but the ongoing aspects of their data. So I definitely say that would be awesome, but I would let the panel discuss that as well.
I'd like to answer that question. In terms of the data and research, where it requires a lot of information to make a finding, and it is normally a survey that happens, and people really don't get any, benefits from it. And in this case, I would, yes, there is a potential, and how I see it is that instead of it's becoming a cash kind of a tokenize, it's mostly goes towards your medical requirement, like medication or your insurance or anything to do with the industry. Therefore, the token is useful, very useful within the ecosystem where all the participants accept that token, and also the researchers, yes, can be given, because the ownership, it's still, you're not giving it for good, because it still belongs to you, but there is an exchange, like having a video on your website, and then whoever downloads it pays you $2 or $3. The same applies within the ecosystem.
Yeah, just to add on that point, I mean, with blockchain technology, patients can connect to their hospital and to other hospitals and collect their medical data automatically. In addition to that, with implementing the blockchain technology, we are ensuring the rights of data subjects of each patient as defined by what Eva Highbury from Iris Guard said of EU General Data Protection Rights of GDPR, because the typical size and sensitivity of medical data is generally believed that the tag information of medical data is not the medical data itself, which will be stored into data blocks. However, some important information, such as information on drug allergies, can be published in a public blockchain, obviously subject to the platform that it's already on. So I believe that the patient will have access to publish some of its data records automatically according to the new EU medical record ID card. As part of having that medical record card, automatic areas of concern, for example, a common thing now, coronavirus. If a patient has known to have coronavirus, that medical data record will be shared with everyone and every hospital globally. But like again, it's only shared if the patient allows that information to be shared, which I'm sure they would, as an example.
I think that blockchain initiative have changed that of kind of patient interaction in the healthcare system. Additional to security features, in patient-centered healthcare ecosystem, the patient has an active role. There could also be an impact on how patients monitor their own health information. Patients who are part of this new healthcare ecosystem, patient will be able to approve or deny any sharing or change to their data. Utilizing the blockchain also create an environment in which all participants, include patient, review information. This provides a great opportunity for healthcare providers and patients to evaluate information, to preserve the accuracy of data through the blockchain. Patient health records currently contain heroes. Switching of the kind of collaborative system has a potential to improve patient care and reduce of the risk of the life-threatening mistake. I think that the benefit is not only monetary. Token is the benefit is the safe healthcare attention.
Thank you for that. And I'd like to again thank everyone for joining this presentation. And if you have some additional questions for either Patient Tori Association or myself, contact information is on the screen. Everyone have a great day and thank you again.